You want to smile?
Yeah, why not? So, Bob, tell me about your experience at Cazes Family Dentistry. What brought you here?
I called 1-800-DENTIST, and this is the place that I was referred to.
Okay.
I said, I'm glad about it.
Excellent. I'm glad to hear that 1-800-DENTIST worked out so well.
Yes.
So what kind of problems were you having when you came in?
Well, I had busted one tooth, and I came in, and the dentist actually went through everything that was wrong with my mouth. And I knew that my teeth were 30 years old, and they should be adjusted. But I was under the impression it was going to cost me 10, 15 grand. I said, he did a fantastic job. He reworked my original bridge, upper bridge, and it fits fine. And he reworked my lower, added teeth to my lower where there were no teeth, and he put 2 small pins in. Everything I heard about putting pins in, you go for like weeks with pain. So I was a little skeptical there. Fortunately, he said on a scale of 1 to 10, it's probably going to be maybe a 1. At the most, 1.5. Well, I'll tell you, he drilled the holes in the bone, put the pins in, sent me home with the teeth in my mouth, and I had no pain. No pain. I had discomfort, but I didn't have any real pain. I said, walked in the house, and my wife said, where's your teeth? I said, they're in my mouth. She says, it's all done. I said, pins are in, the teeth are in. I said, I'm good to go. I said, we have to probably go back and make some final adjustments, but I said, it's great, and I love them.
That's awesome. So, since we've done the adjustments, have you had any particular issues, or?
No, everything that I, if you want to call it a complaint, it's not a complaint, but everything I had a complaint about was fixed in a half an hour. I said he knew what he was doing, and he just ground off some here or some there, take a little there, a little here, and it's back and feels great now.
Excellent. So would you recommend this kind of treatment to anyone else?
Definitely. I would definitely go, especially for your lowers, because people know that lowers are usually floaters. I didn't even think they could do it to me because it's been so long without the bottom teeth that I didn't know where the bone was. Well, X-ray showed that it was in a place where it could be done, and he put in 2 pins, and now my lower teeth are locked in. Right? Even a thief couldn't take them out of my mouth.
That's great. So tell me, a lot of people are concerned about, having the pins placed, the mini implants placed, because they think it's going to be a big surgical procedure. What was your take on that?
Well, I asked about that, and he said there's 2 ways of doing it. One way is to just go right through the gum and into the bone. It all depends on what kind of shape the bone is in and where it is. So I said the other one, he would have sliced the skin, the gum, and then go into the bone and put the thing in, and that's a little bit more invasive than doing it the easy way, where you just go through the skin into the bone. Mm-hmm. Fortunately, I assume that something's good about me. The bone in my mouth was very healthy, very hard. So we opted for the less invasive plan, which is go through the gum. And he put the 2 in about a half hour. And he fit the teeth in there, popped them in, popped them out. Said, okay. There's a little adjustments here and there that have to be made along the way. Anybody should expect that. You'd be a fool if you didn't. But as far as what was done to my mouth, I can't believe that it was so easy.
That's excellent.
It's great. I love it.
Terrific. Well, thank you very much for being such a great patient, and thank you very much for telling other people, sharing your experiences.
So, yeah, I'll rant and rave about them till the
Excellent.
day I die.